Dr. Francis Falk, and it is my pleasure to introduce you to the Falk Medical Multifunction Tonometer, the FAT1 device. This next generation multifunction technology has been cleared by the FDA for the measurement of intraocular pressure, ocular pulse amplitude, central retinal artery pressure, and outflow facility. These tests are used in the management of glaucoma, diabetic eye disease, macular degeneration, and vascular disease. They are also helpful in risk assessment. At Falk Medical, we began this process by studying the limitations of the existing instrumentation. With extensive research and development, we have created a device that overcomes the inadequacies of current technology. The FAT1 device expands the number of tests available, improves measurement accuracy, and prevents the spread of infectious disease. Taken together, it leads to better and safer patient care. It also adds to your bottom line. Let's take a closer look at the FAT1 device. The FAT1 device is a risk assessment and management device that is cleared by the FDA for tonometry, ocular pulse amplitude, tonography, and optodynamometry. It is also the only device with a fixed-use disposable prism that blocks transmission of infectious disease. Functioning as a tonometer, it will measure intraocular pressure, which is an important risk factor for the development of glaucoma. Based on current published research, we all know that the current devices available for measuring intraocular pressure are not as accurate as they should be. IOP varies with the cardiac cycle. It is naturally higher during systole and lower during diastole. Let me emphasize this point. The intraocular pressure is higher during systole. The pulsating wires of the Goldman demonstrate this. The Goldman cannot and does not measure the systolic intraocular pressure. When the wires are aligned, that is the diastolic intraocular pressure. All the other existing tonometers have the same issue. They do not have the ability to know what phase of the cardiac cycle they are measuring intraocular pressure. It is random. The FAT1 device measures the intraocular pressure during systole and diastole from multiple cardiac cycles and displays the true average IOP. It also measures and displays the ocular pulse amplitude, which is the difference between the systolic and the diastolic intraocular pressure. Here is another problem. Because current devices do not take multiple measurements, you have no way of knowing how accurate or precise the results are. If you do not know the accuracy of the data, how can you perform an accurate risk assessment? The FAT1 device takes multiple measurements, calculates the average and the percent variation so you know the accuracy and precision of the result. Tonography is a procedure done to measure the flow of aqueous humor out of the eye. Based upon existing published research, the fundamental cause of glaucoma is impaired outflow of aqueous humor. The greater the resistance to outflow, the higher the intraocular pressure. Again, reduced outflow is fundamentally the cause of glaucoma. Glaucoma medical and surgical therapy is directed at improving aqueous humor outflow. To effectively manage glaucoma and the response to therapy, you must measure outflow. Tonography allows you to practice with greater accuracy and precision. In our research, we discovered an important relationship between the central retinal artery, the internal carotid artery, and the risk of stroke. The FAT1 device can perform a procedure called ophthalmodynamometry. This 3-second test measures central retinal artery pressure. Decreased central retinal artery pressure can be a sign of carotid artery disease. Carotid artery narrowing is the most common cause of stroke. In our clinical trial, we found an undiagnosed internal carotid artery aneurysm and were able to save the patient's life. The FAT1 device can also estimate the ocular perfusion pressure, which is a new and important risk factor in managing glaucoma. Ocular blood flow is determined by the ocular perfusion pressure. Based on current published research, decreased ocular perfusion pressure is a risk factor for glaucoma progression. Decreased ocular perfusion pressure has also been associated with antivascular endothelial growth factor injections for the treatment of wet macular degeneration. Optodynamometry can be used as an additional risk assessment tool in the management of vascular disease, glaucoma, and macular degeneration. The FAT1 mounts on the slit lamp microscope. The device compensates for corneal wetness, thickness, and elasticity, eliminating the measurement errors associated with the use of the invert Fick law. This is a significant improvement over current technologies. Here is another serious problem that must be considered with use of the current technology. Published laboratory studies have confirmed that infectious agents exist in the tears of individuals with Creutzfeldt-Jakob disease, commonly known as mad cow disease, hepatitis B, hepatitis C, and HIV/AIDS. These studies have also confirmed that disinfection procedures for current tonometers do not eliminate the infectious agents, and that all current tonometers, both contact and non-contact air puff, can transmit infectious disease. Voluntary tip replacement and tip covers are not viable options. There is no requirement that they be used, and they can be reused once contaminated. With air puff tonometers, the infectious tears become airborne, contaminating surrounding surfaces, and also represent an inhalation risk. The FAT1 solves this problem with a unique patented disposable plastic prism that must be changed before a measurement can be performed on a different patient. The FAT1 will not function if the prism has been used. It must be changed between each patient. This is an absolute barrier. We all know that good medical practice requires techniques that prevent the spread of infectious diseases. With this system, no one can allege that you may have infected them. FAT1 user touchscreen display interface has the ability to store data. Simply place a mini USB flash stick in the USB port. In the upper left-hand corner, press Save. On the keypad, enter a numeric file code and press Enter, and then Save again. The data is then transferred to the USB flash stick in an Excel file format. To view the file, place it into a computer with Excel. The Falk Medical multifunction tonometer establishes a new standard for eye care professionals. It samples the systolic and diastolic intraocular pressure, which is the true intraocular pressure. The FAT1 device takes multiple samples, which increases measurement accuracy and precision, which allows for better patient management and risk assessment. The tonography function estimates the resistance of aqueous humor outflow. The fundamental cause of glaucoma is decreased outflow. Using tonography, the effect of medical and surgical treatment on outflow can be more accurately assessed. Many vascular disorders can affect the eye. Optodynamometry estimates central retinal artery pressure, which is the major force driving blood flow into the eye. The opposing force is the intraocular pressure. The optodynamometry function can be used to estimate the difference between the mean central retinal artery pressure and the intraocular pressure, which is the ocular perfusion pressure. The ocular perfusion pressure is useful for estimating the risk of stroke, managing glaucoma, and wet macular degeneration. Almost every year we hear about new lethal infectious agents. We now know that lethal infectious agents are present in tears, and current tonometer disinfection regimens do not eliminate them. Thus, all current tonometers pose a significant risk for transmission from patient to patient. Recent published research has shown that hepatitis C is now the most common cause of infectious disease death, and the incidence is expected to rise. Research has also shown that the virus is present in tears. The FAT1 fixed-use disposable prism blocks transmission of infectious agents. Thank you for your time. For more information on the FAT1 device, including clinical trial results, go to falkmedical.com. To arrange a demonstration, contact Falk Medical at 860-536-9000.